I washed the heart again. So now it's actually very clean. So the chamber we were discussing is the left ventricle. This is the left ventricle. So I've opened up the left ventricle. See, the left ventricle is actually a small chamber, but its wall is thick. That is why it seems small, and it's very hard. I'm finding it very difficult to retract it. It's so muscular. So we saw the trabeculae carneae consisting of the papillary muscles and the muscular bridges. The pillars are the papillary muscles, in fact. So we have the anterior papillary muscle, which is attached to the sternocostal surface, and we have the posterior papillary muscle attached to the diaphragmatic surface. And here we have the chordae tendineae, and here is the left atrium. So I have opened up the left atrium. So open it a little bit more. So here we see the bicuspid orifice. This is the bicuspid orifice that leads to the left ventricle. So the bicuspid orifice is guarded by bicuspid valve, or it's also known as the mitral valve. So it consists of two cusps, the posterior cusp and the anterior cusp. The anterior one and the posterior one, right? The papillary muscles give attachment to both the cusps. Anterior and posterior papillary muscles, they give attachment to both the cusps. So these cusps have a similar structure like that of the right ventricle. So they have an attached margin that is attached along the annulus of the mitral valve. So mitral valve annulus, that's a collagenous ring. And then it has got a free margin. The free margin is giving attachment to the chordae tendineae. The chordae tendineae are also of similar types like we discussed in the right ventricle. But the major difference here with the cusps is that the anterior cusp, this is the anterior cusp or the anterior leaflet, it does not have a basal zone. Okay, so when I told you the structure of a cusp, it consists of three zones: rough zone, clear zone, and basal zone. The basal zone is absent in the anterior cusp of mitral valve. Okay, and the posterior cusp is just like the posterior cusp of the right ventricle. It has got two clefts with the three scallops, and the type of chordae here also same. The type of chordae here are commissural cords, which are attached to the commissures. The commissures are the junctions between the cusps. The commissures in the left ventricle are called the anterolateral and posteromedial commissures. Okay, so the commissures are anterolateral and posteromedial. So anterolateral and posteromedial are the commissures we find here in the bicuspid valve. Okay, so the difference here is the anterior cusp does not have this one does not have the basal zone. And the types of chordae are same: commissural cords and cleft cords, free marginal cords, rough zone cords, deep cords, and the last ones are the basal cords. So everything is very similar here, where the outline, the circumference of the bicuspid valve orifice is less. It is about 7 to 9 centimeters, whereas the tricuspid valve circumference is 10 to 12 centimeters. This is 7 to 9 centimeters. It is variable, but usually the average measurement is 7 to 9 centimeters for the mitral valve orifice, the circumference, its circumference. So this is the rough inflow tract, and the smooth outflow tract of the right ventricle, it leads to the ascending aorta, this one. So we have the ascending aortas have passed the forceps here. So this end reaches the smooth part of the left ventricle, and that becomes continuous with the ascending aorta. So this is about the interior of the left ventricle. Now let's open so we have already opened the left atrium. Left atrium is more muscular than the right atrium. its muscle wall is thicker than that of the right atrium. Okay, even though most of it is smooth, the most of left atrium is smooth, the posterior part, in the smooth posterior part of the left atrium, we have the openings of the pulmonary veins. So these 4 pulmonary veins, superior and inferior pulmonary vein, right on the right and left sides. So 1, 2, 3, 4. These pulmonary veins open to the left atrium. So this opening of the pulmonary veins is on the posterior wall of the left atrium, which is smooth. Right. A small anterior part is rough, and this rough part consists of this muscular pectinati, just like the right atrium, and it forms the ear-like appendage, that is the left auricle. So it is the left auricle that consists of the rough part, that is the muscular pectinati. Every other region within the left atrium is actually smooth. So the features are very minimal here. So what are the features you find here? The features are only on the septal wall. See, this is the right atrium, this is the right atrium, this is the left atrium, and in between right atrium and left atrium we have this septal wall. The septal wall will show this projection of the fossa ovalis. This is the fossa ovalis. The fossa ovalis here, sorry, the fossa ovalis. The fossa ovalis can be seen as a small projection. It's called semilunar margin that will correspond to the lower part of this fossa ovalis. So this is the septal wall showing the semilunar margin, So the fossa ovalis, that is the lower margin of the fossa ovalis, that is seen as semilunar margin on the inside of the left atrium. That's all the features you find in the left atrium. So when you open the left atrium, it's more muscular than the right atrium. Its wall is thicker. You can see this is the wall of the right atrium. This is the wall of the left atrium. So it is thicker. It is about 3 mm thick, the left atrium, and most of it is smooth. In the posterior part of the smooth interior of the left atrium, we have the opening of the 4 pulmonary veins, right and left, superior, inferior pulmonary veins. And then rough part has this ear-like structure, that is called left auricle. Left auricle can form thrombus, and this thrombus can dislodge in systemic parts, or in the kidney, or in the brain. So it can cause systemic embolism, or renal embolism, or cerebral embolism, right? Whereas the right auricle, the thrombus formed due to right auricle can cause pulmonary embolism. The left auricle causes systemic embolism, renal embolism, and cerebral embolism. So that's about the interior of the heart. So quickly, the right atrium, the rough anterior part, smooth posterior part, the right ventricle, the rough inflow part called the trabecular cornea, which consists of bridges and pillars, and the smooth outflow part, that is called the infundibulum. And the left ventricle here also consists of rough inflow part and smooth outflow part. The smooth outflow part becomes continuous with the ascending aorta. In the left atrium, most of it is smooth. The rough part forms this left auricle. So it's about the heart. So this is the heart with its internal features. Thank you very much for being so patient to listen to all the descriptions, and I apologize for in the disturbances in between. Thank you very much. Please watch all the videos. Thank you.